Hi, this is Dr. Jonas here to talk about the Wegovy Pill. Really to go over a summary of what to expect. You're a Medicare patient, you're ready to lose some weight, and you're ready to move forward with this new program, and you want to start the Wegovy Pill. So the first thing is you should expect about a 14% weight loss if you are able to get to the highest dose and maintain on it for about a week. That's what the clinical studies showed. Also, something that's not well known is a benefit of Wegovy is someone who has cardiovascular disease, having had a heart attack or a stroke, will get a benefit of protection to avoid a future heart attack, a future stroke, or dying of heart disease. That is an added benefit of the Wegovy pill for the weight loss patient. In summary, this pill is called semaglutide. It's similar to the medicine that's in the shot that you well know, Ozempic, and it's called semaglutide. It's a GLP-1 receptor agonist, and the receptor, as we call it, is stimulated, the GLP-1 hormone is released, and you get an appetite suppression effect in the brain. The stomach slows down, the small intestine slows down, and food is passing through more slowly. That's how the medication works. And the weight loss effect is mostly thought to be from the central nervous system up in your brain, telling the brain that you don't need to eat. That's how it works. The dosing of the medication, well, it's a pill, and it's meant to be taken in the morning with a sip of water, 4 ounces or less of water. Remember that, less than 4 ounces, not more. And you've got to wait 30 minutes before eating or taking of your other pills because the medication has to get absorbed through the acid of the stomach, and the medication has chemicals in it that help that process happen. So you've got to wait 30 minutes before you get to your other pills. The weight loss effect and the studying dose is the 25 milligram dose, or the fourth dose, or the highest dose. All the data, how much weight am I going to lose, what's going to happen, is based on being on that dose. Doesn't mean you won't have a brisk response or a great weight loss response to the lower doses. Everybody's different, and especially if you're new to the medication, never been on a weight loss medication before, you may respond to some of the lower doses. Officially, though, only the 25 milligram or higher dose is considered the weight loss dose, but we're all different, and some of you may respond to a lower dose. Now, don't forget, the reason you're going to move that dose up, you're going to go from the lowest dose to the highest dose, is to give yourself a chance to get used to the medication. The most common side effects are all related to your stomach. Nauseousness, vomiting, diarrhea, constipation, those are the big guys. There can also be acid reflux, there can also be gas, that can also be abdominal discomfort or pain, and we expect those to pass as the week goes on, and also as the weeks go on the dose. And when those symptoms are gone, it's time to move to the higher doses. There are also things that you can do to try to mitigate those effects, eating differently, maybe in smaller quantities, maybe milder foods, less fatty foods, and things like that will help you get through that time frame when you move to the higher dose. Also, there are other diseases to talk about with the medication. It's very important that your prescriber knows what you're taking for medicines, what issues you may have with health-wise to move forward, and to know that the medication will be appropriate for you. So again, the Wegovy pill will be one of the 4 medications that will be available under the new Medicare weight loss program starting July 1st of 2026. And with it, you can expect about a 14% weight loss if you're able to stay on the medication for about 1 year at the highest dose. And you will get cardiovascular protection from heart attack and stroke if you are a patient who may have cardiovascular disease. So that's an added benefit from the medication, and that could be a reason why this medication could be for you. Also, it is a pill, not a shot, and some patients prefer that. So this will be one of the medications available on the Medicare program. We wish you great success with that program.